For this time, our patient is Nick. He's 20 years old. His lifestyle is a full-time student studying in La Trobe University. His exercise is going to the gym twice a week and also playing basketball. During his basketball game, he was having a fast break, and suddenly, one of the defenders pushed him from his back. Therefore, he lost his balance and hit on the ground with his left leg. It caused a huge pain immediately, and he is not able to fully weight bearing on his left leg. Previous medical histories: he had an ACL surgery on last Christmas.
Hi, I'm Oscar. How are you
Hi,
doing?
I'm Nick. Nice to meet you.
Yeah, nice. Come on in.
Thank you.
Can you tell me why you're calling today, Nick?
Sure. I did my ACL last Christmas and had surgery on it and it was healing all right. But last Sunday during a basketball game, I think I overstretched the ligaments in my left knee.
Yeah. No worries. Can you tell me more about what were you doing when you think you overstretched your ligaments?
Yeah, sure. I was during the game. I was on a fast break, and as I was laying up to the basket, one of the defenders pushed me, and I bumped into my left-hand side. So I lost my balance and hit the ground pretty hard on my left leg.
Yep.
At that moment, I got a pretty large pain on the left knee, right on the internal aspect of it.
No worries. That obviously very painful for the time. Does it take a long time for you to feel better, or it getting worse over the days?
It keeps getting worse most of the days, yeah.
Alright. How's your ankles or hips?
No, I can just feel it in my knee,
Yeah,
yeah.
just yeah. Alright. Can you tell me what are the factors that making the pain of your leg getting worse?
It hurts when I'm walking or just putting any weight on it at all.
Yeah, no worries. After getting some information from you, it seems like it's leg ligament injuries. So for today, we are going to do some assessment tests for you, which is focusing on your leg ligaments and joint structure. This test requires me to apply some pressure on your leg joints and move your lower limb in field directions. Is that okay for you?
Yeah, that's fine.
Yeah, cool. Just follow me.
Thank you.
Nick, how are you doing?
Good, thanks.
Yeah, Dr. Tsang. Today we're going to do some simple tests to test the range of movement and the ligament stability of your legs. Will that be okay for you?
Yeah, sure.
Yep. Can you just confirm your full name and the day of birth?
Sure. Nicholas Maloney,
Yeah.
19th of the 5th, 1996.
Yep. Sure. That's fine. And in the pointed position, we're facing downward.
Sure.
Yeah, sure. Fully press with your knee joint.
Sure.
This test involves using a goniometer to measure the degrees of flexion and extension of leg joints actively and passively. Once the angle of the joint is obtained, I have to mark it down on patient's assessment form.
Now I will passively pressure the joint.
Next test is anterior posterior jaw test. For this test, you have to lie on the back and facing upward.
Sure.
Yeah. Can you please press your hip into 45 degrees and 19 degrees for the knee? Perfect. Later on, I will sit on your foot for stabilizing or apply anterior force of your knee joint.
This test is anterior and posterior draw test, in order to test the stability of ACL and PCL. For the following tests, patients have to lie on a supine position facing upward and press their hip joints into 45 degrees and 19 degrees for their leg joints. An orthotist will sit on patient's foot for stabilizing and apply anterior and posterior force to the proximal tabula to see if there is any anterior or posterior shift of tabula under the femur.
Final test is the varus and valgus test in order to examine your stability of MCL and LCL. Can you please fully extend your leg joint?
The final test is varus and valgus test, in order to examine the stability of MCL and LCL. Patients have to fully extend their leg, and orthotists will put one of their hands on the lower leg just above the ankle joints and the other hands on the femur for fixing position. After that, orthotists will externally rotate patient's scapula and perform passively abduction and adduction on the patient's lead joint to see if there is any medial or lateral shift of the tabula under the femur.
Hi Nick, how are you doing?
Good, thanks.
Yeah, okay, from the result from the test we did yesterday, I've come to a conclusion that you have a MCL and ACL tears. However, I'm not sure what grade this is. So what I'm going to do is to send a referral letter to your GP and ask him to require for an MRI scan. And after we clarify what grade is your tears, we will make you an orthotic device for you to control your knee joint movement. You got any questions?
No, that should be fine, thanks.
Yeah, cool. I'll see you soon.
Alright, awesome. Thanks for that.